Hello.
Hello. Good morning, sir.
Good morning, sir.
Is it okay to talk now?
Yes, sir.
Are you
Yes,
busy?
sir. Yes, sir. No, please.
Yep. Sorry?
हाँ please बताइए sir.
Yeah. Okay. So, first of all, great to know about the progress that you are making across diseases.
Thank you.
So happy to read through and see through that. It's great.
Thank you, sir.
Yeah, and regarding my dad, his edema and all was completely cured following your advice. After that, we reduced the insulin slightly from 12 and 11 to now he's 9 and 8.
Yes.
9 units in the morning and 8 units in the evening.
Yes.
Now, slightly the sugar has improved, increased now. Now the fasting sugar comes to around 220, 240 range. The past 2 days.
And random?
Random is around 6. Random is around how much? It's nearly 300, 280 to 300.
Okay.
That's only in the past 2 days. Before that it was very low. So we reduced the insulin again, and then now it is increased. So now what should we generally do? His energy levels are pretty okay now. He walks for around 45 minutes. His water intake is around 600 ml. 600 to 650.
Okay, you can add salt to his water, maybe for a day or so.
3 times.
And
okay, 3 times or?
Yeah, I think 3 times should be okay unless his blood pressure shoots up. So if you can
that I'll check. You said yeah, that I can monitor.
Yeah, then you can increase. You can take salt for 1/4 spoon of salt for 1 day. Okay. And next day reduce the water intake further to about 400, and then see how it responds, because every week try to give salt for 2 days, and after next day after the salt reduce the water intake slightly so that excess amount of fluid from the cells come out, and if that happens, then in a week 10 days or 15 days the insulin should stop completely.
Okay.
Without,
that means every week 1 or 2 days like that, right?
Yes.
Okay, got it. I'll try that, sir, and I'll keep you posted. And as of now, generally it is the whole journey has been unbelievable. From what reading through what you have written, most of the things are very true. The way that the whole medical industry is working seems to be in that sense only.
Yeah, I have some issues on managing the blood sugar, but for the last few days I am trying out this thing, that salt intake, because I believe that beyond a point it is not possible to take out the fluid from the cells. So in case the cells give up the fluid, the blood sugar come to absolute normal thing, and one should be free in about a month's time to have any sweets or anything. Like it should be as good as it was maybe 20, 30 or 40 years back.
Yeah, and actually speaking, like you said, even following all these things, the energy levels, the quality of life improves tremendously. Even following the medical advice, actually the quality of life really deteriorates. The patient getting more and more tired, and beyond a point, if we go to the same doctor again, they'll tell either it's psychological or increase the medicine, keep increasing the medicine.
Yes, that's what they do normally, and that is something which is very frustrating, because people go to the doctor for getting relief and they kind of make a fun of you by saying psychological things and other things.
Exactly. If they don't have any comeback, most probably that is what, in my experience also, it's the same thing.
Yeah.
Similarly, now another trend that I think it's seen is that, like I said, he had constipation. That's what actually, not even diabetes. Diabetes has an added advantage for us. He came to you mainly, for constipation. He was having that trouble, and we tried all those things, and I also consulted the best technically, he's in Kerala, in Cochin. He has got a Padma Bhushan and all. So I went to him, and
Dr. Hegde. Dr. Hegde.
Not Hegde, his name. Not Hegde. I think he is, his name is Philip Sebastian.
Okay, Philip Sebastian. Okay.
So, he's a, what do you say for it? He, what he suggested, some of the medications, and to top it off, he also gave an antidepressant.
Okay.
So I asked him, why the antidepressant? He said, irrespective of what you think, generally, this is the way that we follow. Again, I'm doing, some talking and research. It seems that antidepressants, once you start, you have to keep increasing that. And the patient suffers mentally also.
Yes.
So the whole point of increasing, like you said, the connection is very clear. The people who make anti-constipation medicine have started making depressants as well. So somehow, some reports or some through some mode, I think it's what's happening.
Yeah, and these guys are not even thinking even once antidepressants are given to children as young as 4-year-old for bedwetting problems. You can just imagine what will happen to, you can just think of what will happen to the child when he grows up. He'll have diabetes, he'll have blood pressure, and he'll have anxiety issues also.
Exactly.
And that is why in America, like anxiety issues are very, very high. Like percentage of people suffering from anxiety is very high because they are usually given like antidepressants at a very young age.
Okay. Oh, that might be the reason that is increasing the whole, culture itself there.
Yes, and that is what shooting, like impulsive people are there. They indulge into all kind of things.
Yeah, exactly. True. So anyways, like you said, I really hope and pray that, in addition to our, well-being, the message should reach, more people, and they should take it more, all the best to you for that.
Thank you very much. And do share.
I am also sharing it with as many people as possible. The only challenge that I am facing is that the industry is so deep that they are not believing, many of them.
Yes,
so I can give my example to them that, generally the whole, concept of con men and earlier, having simple relief, it's not, in our psychology, it's ingrained that, we'll have to take medicines to cure diseases.
Yes, I know it will take time, but definitely it will come through.
Yes, more people, start trying it, the more, it will spread actually.
Yes.
Okay, sir. I'll also keep you sharing my feedback. And
sure. Thank you.
All the best.
Thank you.
Thank you, sir.